Hello, welcome to my presentation of eye movement desensitization and reprocessing, also known as EMDR. This is in fulfillment to the presentation requirements for Trauma 840, empirically supported treatments for trauma at Liberty University.
Imagine you're a professional MotoGP racer. You've been doing this your whole life and you've made it to the top level of your sport. During a race, you become involved in an accident and your whole career seems to be crushed in an instant. You can no longer see your bike. You can no longer be around your bike. You can't even think about getting back on the bike. What do you do? How do you get back from this?
Throughout this presentation, we'll be discussing EMDR's efficacy in treating multiple types of trauma, specifically post-traumatic stress disorder, or PTSD, phobias, and integrating a Christian worldview into EMDR. To begin this presentation, we'll be discussing what is EMDR, when is EMDR used, how does EMDR work, what is the 8-phase approach to EMDR. I'll provide a short video example of an EMDR session. I will also go over Christian worldview and what do Christian scholars have to say about EMDR.
So what is EMDR? Although the therapy is called eye movement desensitization and reprocessing, directed eye movements are only one form of stimulation used as part of its complex methodology. EMDR is an imaginal exposure therapy developed by Francine Shapiro in the late 1980s. It follows the adaptive processing model, which identifies memories of negative experiences as a cause of mental health problems. Neurobiological and memory research has shown that memories of sufficient trauma and disturbing life experiences are incorrectly stored in the brain's memory centers. As you can see here, there are two pictures of the brain. The brain on the left shows the brain activity before EMDR. The brain on the right shows the brain activity after EMDR treatment. EMDR has shown significant positive results in reducing prolonged grief and depression. Memory reprocessing through bilateral stimulation, or BLS, is the left and right tapping, audio tones, or other movements not limited to the eyes. This all occurs during imaginal exposure. By activating the right and left hemispheres of the brain, one may access the disturbing memories associated with trauma or grief. EMDR is a psychotherapeutic approach with proven efficacy in the treatment of PTSD. Randomized controlled trials, or RCTs, have also shown EMDR to be effective in treating comorbid traumatic events like psychosis, bipolar disorder, unipolar depression, anxiety disorders, substance use disorders, and chronic back pain.
These are the voices of people who have lived with post-traumatic stress disorder, or PTSD. Sometimes PTSD can start right away after something happens, and other times it takes a while to notice symptoms. Either way, when a person has PTSD, it usually means that painful memories become a problem in a person's life. And that's when someone might need some help. But PTSD is a condition that can be treated. There are a few therapies that work especially well, and eye movement desensitization and reprocessing, or EMDR, is one. EMDR is an evidence-based treatment, which means it's been proven to be effective more often than most other types of therapy. During EMDR, a trained therapist works with a person to keep the sessions comfortable and relaxed, but also to achieve the goals they set together. Relaxation and breathing exercises might be taught early in the sessions, so they can be used later. People then talk about the memories that have been most difficult for them. While they're telling the stories of their trauma, they're also watching something right in front of them, such as moving lights or the tip of a pencil being waved back and forth. The repetitive eye movement can be distracting or calming, and telling the story becomes easier. This is desensitization. Next, the feelings that go with the memories of awful, traumatic moments, or years of traumatic moments, can change. Those feelings shift during therapy, and how people think about themselves in relation to their memories can be dramatically different following EMDR. This is reprocessing. The memories start to have far less power than they did before the treatment. The best news is that EMDR usually doesn't take that long. The feeling that a person is stuck in the past can change with EMDR. People with PTSD can become fully present and live their lives the way they intend. PTSD can be treated, and people can get back to the lives they want to live.
As we have previously discussed, working memory can be rewritten through bilateral stimulation. This includes eye movements, tapping or handheld buzzers, auditory sounds, or lights. As you can see to the picture to the right, there is a light bar at the top. When using BLS during a recall, dedicated memory resources are limited. This allows the memories to become less vivid and emotional in the future. EMDR is supported by extensive research, and it has gained worldwide recognition as an effective trauma treatment. And it is also recommended as a premier treatment for PTSD. It has been identified as a preferred treatment for trauma victims affected by terrorism by the Israeli National Council of Mental Health in 2002. It has also been noted that it is effective and supported by research according to the International Society for Traumatic Stress Studies in 2009. In 2010, the United States Department of Veterans Affairs, also known as the VA, established guidelines creating EMDR in the categories of therapies with the highest levels of evidence. So when is EMDR used? EMDR is not for everyone. If you are unwilling to address your feelings and unwilling to learn about new techniques, or if your problem is biological, then EMDR will not be beneficial. EMDR can be used to treat panic attacks, complicated grief, dissociative disorders, disturbing memories, phobias, pain disorders, performance anxiety, stress reduction, addictions, sexual and/or physical abuse, body dysmorphic disorders, personality disorders, PTSD, and other traumas. Fear is a common focus of EMDR, and fear can become a phobia. Once fear becomes a phobia, the individual will spend most of their time avoiding that fear and anything associated with it. A particular EMDR protocol was developed to target phobias, and it's aimed at the pivotal events causing phobias and anything that holds the fear in place. Treating specific phobias using EMDR is predicated on the experiences of intense emotional disruptions caused by specific situations that precipitate the development of phobias, and how processing the memories of the phobia through EMDR decreases the intensity and prevalence of related phobia symptoms.
The only memory I can have associated with where this might come from is being in the States at about 5 years old. It's so extreme, Rebecca. I wake up, not so much these days, but screaming. I just see them everywhere.
Okay, so if I say the word spider,
Yeah.
what does that, what do you feel when I say the word?
Like I'm that far from a psychotic break. I'm not kidding.
Yeah.
I've given you my doctor's number.
So we're going to start with a relaxation, just to help you feel quite calm before I start the process. For you. So I can do a full hand like that, and you follow with your eyes exactly like that. No distress doing right now.
But if I keep staring at it, not so much. But they're going, this is a dream. This is not happening.
What did you do to get yourself here in this position?
Met you.
How have you managed to come this close to a spider?
Because you're doing this and I'm engaging with it, going, enough is enough.
Doring and other researchers in 2013 conducted a study to investigate the use of EMDR in treating dental phobias in medication-free patients. The study included 31 patients, randomly selected, and assigned to a waitlist or given 3 sessions of EMDR. Each EMDR session was 90 minutes in length, targeting specific adverse dental events. Results from the study showed that EMDR was successful in significantly reducing dental anxiety and avoidance behaviors. 12 months post-intervention, it was shown that 83.3% of patients were receiving regular dental treatments. Trauma can change the brain in many ways. In the amygdala, psychological trauma causes excessive arousal. This results in an exaggerated alarm response to the external stimuli. In the dorsolateral frontal cortex, also known as the DLFC, when someone is suffering from PTSD, the DLFC will not exert an inhibitory effect on the amygdala. This results in hyperactivation of the amygdala from traumatic stimuli. As you can see on the right, the picture here shows what happens to the brain before the first EMDR therapy session. In the medial prefrontal cortex, or the MPFC, increases in the responsiveness of the amygdala interfere with the MPFC regions, including the rostral anterior cingulate cortex, the ventral medial frontal gyrus, and orbital frontal cortex. The MPFC region is vital to executive functions and mediating transfers of traumatic memories from subcortical structures. In the hippocampus, PTSD patients show a reduction in the volume of the hippocampus. This causes a functional inhibition to the cognitively evaluate the trauma and results in memory disorders. The limbic and paralimbic cortical regions display a difference in density of gray matter throughout the regions. They also elicit emotional distress and parasympathetic symptoms. The Broca's area becomes partially disabled. This may explain why clients with PTSD have difficulty describing, verbalizing, and cognitively restructuring the traumatic event. As you can see to the picture on the right, after the last EMDR therapy session, many changes have occurred. There is a deactivation of the orbital frontal structures, a deactivation of the subcortical limbic structures, and an increased activation of temporo-occipital cortex. Extensive research on EMDR has shown that approximately 5 hours of EMDR eliminates 84 to 100% of PTSD symptoms in civilians suffering from a single traumatic event. This includes rape, accidents, and disaster. As more trauma occurs, of course, more treatment would be needed. And EMDR has been proven effective in civilians with multiple traumas as well. With 8 to 12 hours of treatment, 77 to 80% of elimination of PTSD symptoms has occurred. A recent Kaiser Permanente study reported that 80% of multiple trauma victims and 100% of single trauma victims eliminated their PTSD symptoms with an average of 6 50-minute EMDR sessions. So how does EMDR work? The client will recall a traumatic event and then focus on the visual image, negative beliefs, bodily sensations, and emotional responses associated with the event while engaging in bilateral stimulation. EMDR combines physiological and psychological mechanisms of healing. It has been so effective that people working through EMDR have reevaluated their views regarding health, healing, and the interaction of the body and mind. EMDR taps into a person's physiological systems, enabling their innate healing to take over. Patients working through trauma using EMDR come to see their past suffering in relation to their whole life. In the beginning of EMDR, a client will be asked to think about the most disturbing aspect of their trauma. Once they have that image held in their mind, the therapist will initiate bilateral stimulation. BLS can be done through tapping, audio tones, lights, handheld buzzers, or by the client following the therapist's finger as it moves left to right back across the client's visual field. BLS is repeated multiple times during each session. As previously stated, EMDR works through taxing working memory while inducing bilateral stimulation. The most common form of BLS is eye movement. The exact reason why eye movement is so effective is still unknown. However, it is believed that within the brain is an information processing system designed to organize and maintain upsetting memories. When an upsetting event occurs, it is thought about, talked about, even dreamt about until it is resolved. The resolution of the traumatic event is called adaptive resolution. Trauma interrupts adaptive resolution and causes the memory to be stuck in the nervous system. Through EMDR, the client is asked to think about the trauma while the therapist stimulates the information processing system through BLS and allows the memory to be processed or resolved. EMDR is closely associated with rapid eye movement during sleep. A disruption in REM sleep is also associated with PTSD. It is estimated that 90% of individuals with PTSD suffer from sleep disturbances. Therefore, it is theorized that engaging in eye movements in a conscious state facilitates progress that cannot be made during sleep. This method can also enhance recovery. Successful processing during EMDR is partly caused by engaging the physiological parasympathetic system that relax the body's muscles. Saccadic eye movements caused by the midbrain and muscle relaxation during REM sleep also account for deconditioning effect. This progress made during EMDR may counteract the effects of trauma victims waking during REM sleep. Through EMDR, clients can reopen crucial windows of REM-like activity useful for integration and learning. Sleep disturbances are also related to increases in daytime PTSD symptoms, and they contribute to comorbid conditions like major depression, suicidal behavior, and substance abuse. Because of this relation to daytime PTSD symptoms, it is believed that EMDR can act as a bridge between what is being lost because of an inability to engage in REM sleep and what can be gained during reprocessing.
Ever since that night, I just can't face going out.
I've always had a nagging sense of being a failure, of not being good enough.
My childhood was a mess. I was abused in so many ways.
I had a phobia of dogs. I avoided places where I might see them, which became a real problem.
I was so full of shame. I just felt dirty, and there was no way I could trust anyone, not even my friends.
I've tried different therapies since I was a teenager. Some made me feel a bit better at the time, but the depression kept coming back.
I would lose whole days disconnected from the world, or feeling like I was living in a fog.
If I saw a dog, I was terrified. I would literally shake, and that would make me annoyed, as I knew it was irrational.
Everyone told me I should deal with it and move on, but the thought of telling anyone and talking about it filled me with dread. EMDR therapy gave me hope that I can put that night behind me.
I had EMDR therapy. The first sessions helped me understand that the way I thought about myself was a result of past experiences.
EMDR therapy helped me to process some of the horrendous things from my past.
As we worked through old memories related to my phobia, it was like my fear button started to get switched off.
My therapist told me that it was a recommended treatment by the NHS and World Health Organization for trauma. Also, that I didn't have to go into all the details, which was a relief.
As we worked through different memories, it was like my head and gut finally started to see things the same.
We went very gently to begin because I was all over the place. But step by step, I started to feel a bit better.
When I went outside, suddenly I wasn't scanning around for danger. I'd kind of forgotten what that was like.
As I processed what happened to me that night, the images became less vivid. The shame dropped away, and I could see for the first time it really wasn't my fault.
That belief of I'm not good enough slowly started to crumble, and I realised I am okay. I'm as good as the next person.
With EMDR, I started to leave the past behind.
I began managing situations differently, and I felt the old me coming back.
I'm Lindsay. EMDR therapy allowed me to move on.
I'm Dave. My EMDR gave me hope.
I'm Suzanne. EMDR has given me back my life.
I'm Mike. EMDR therapy was my path to freedom.
Shapiro first used EMDR with combat veterans. This led to the development of the EMDR 8-phase approach. The 8-phase approach integrates aspects of psychodynamic, cognitive, behavioral, and interactional therapies. Phase 1 of the EMDR 8-phase approach is gathering a thorough history and developing a treatment plan. Some examples of a thorough history for adult survivors of a trauma could include early family disruption, absent caregivers, removal by Child Protective Services or CPS, abandonment, death of a caregiver, neglect, violence, failure to thrive, and other serious medical conditions. When developing a treatment plan, it is important to establish an adaptive information processing guided treatment plan. Also, when the client and therapist must agree and adhere to the elements of the treatment plan, some of the things that the therapist would agree to would be through speech, helping the client elicit cognition, and providing verbal support during EMDR sets. Also, the rhythm. The therapist would make sure the BLS and adhere to timing of EMDR sets and breaks. The therapist would also engage in touch, if appropriate, for tactile stimulation and perception of the client, and be aware of their BLS. The therapist would also not misinterpret the client and refrain from commenting and staying out of the way. The therapist would also prompt and be appropriate with maintaining stimulation and react promptly to stress. Phase 2 is preparation. The importance of preparing a client for EMDR cannot be overemphasized. Establishing trust is one of the most critical aspects of preparing a client for EMDR. While the client does not need to go into detail about the trauma, if trust is not established, the client may be unwilling to be truthful about the severity of their feelings. Phase 3 of the EMDR 8-phase approach is assessment. During this phase, the client and therapist will establish which areas of the traumatic event to target during treatment. Phase 4 is desensitization. This is when the client focuses on disturbing emotions and sensations while they are being measured by the subjective units of distress scale. The changes to responses will be evaluated as treatment progresses and eventually resolved. Phase 5 of EMDR is installation. This phase requires the client to install positive beliefs they now have about themselves concerning the traumatic event. These positive beliefs will replace the negative beliefs that they have about themselves. Phase 6 is the body scan. The body scan is performed by asking the client to bring the traumatic memory to mind and identify bodily sensations they may be experiencing. These sensations will be noted for future processing. Phase 7 of EMDR is closure. By properly closing a session, the therapist ensures the client leaves in a better state than they entered. This is very important in EMDR. You do not want to let a client leave the session without having reprocessed the negative emotions they have been feeling. The final phase of the EMDR 8-phase approach is reevaluation. This phase takes place at the beginning of each new session, where the effectiveness of the last session is discussed. In essence, each subsequent session after session 1 begins with phase 8 and ends with phase 7. Let's now recap the 8 phases of EMDR. Phase 1, treatment planning, history. Phase 2, preparation. Phase 3, assessment. Phases 4 through 7 are involved in the treatment plan. Phase 8, reevaluation.
Okay, so what memory would you like to work on today?
I'm going to work on memory on an ex-girlfriend.
Yeah.
When I was 18, when we split up, I was really upset.
Yeah.
It was the first time being in a proper, it was a very intense relationship when I was 18. Lovely girl, you know. When we split up, I was really upset for a long time.
Okay.
It took me about 2 years to go.
How distressing would that memory be to you?
9 maybe.
Fuck,
I thought that for a long time.
Okay. So we'll start processing now. I'll tune you into what to start with, and then as we do a set of eye movements, or we might do taps, or we might do tones, just notice what comes up for you. Just be curious and just notice. And sometimes things will change, or they may not. You may notice other images, other thoughts, other feelings, other body sensations. Other memories may come up, and other times you may not be aware of anything but just the eye movements or the taps or the tones. And there's no right or wrong response, and try not to judge whether something should or should not be happening. Just notice whatever comes up and report back to me after I stop. So I'd like you to bring up that image and those negative words, I'm lost. Just notice in your body where you feel that. Yeah, okay. Okay, and just notice. What's your distress rating for that out of 10? when you think about that now? So 10 is highest level of distress and 0 is lowest.
What, 0, 1?
0 or 1. Okay. Well, could I get you to close your eyes and just focus on that memory again? And just place yourself in that memory. Okay, what did you notice?
Just going through it again. Yeah, it feels okay.
Yeah, okay, just notice that. Let's just try some tapping, just because a different way of doing it, and some other stuff can come up from doing this.
Yeah.
Often people can get more kind of images. So I'm going to get you to put your hands just on your knees like that, and if you could just close your eyes, and I want you to go to that point, the last thing you notice, that it's okay to love someone. If you could just notice that, and I'm just going to start into the tapping. Just notice what comes up. Doing well, just keep noticing. Just old memories. Doing really well. Just old memories. Just notice. Okay, so can you visualize that memory again, and we'll start processing again with that memory?
Yeah.
Okay, do you want hand movements or tapping?
Tapping.
Tapping, yeah, okay. What did you get?
It's okay.
Yeah. What's the distress rating when you think about memory now?
It's okay.
Yeah, if you were to rate it, 0 being no disturbance at all, 10 being highest?
0.
0. Okay. Okay, so when you think about the original incident now, how true do the words "I am strong" feel to you out of 7? 7 is completely true.
Oh, really? Pretty strong.
Yep, yep. Okay, out of 7?
6.
Okay. Just hold those words together when you think about that incident. Think about the incident and the words "I am strong." What did you notice?
More relief.
Yeah, just notice that. What?
More relief.
Yeah, just notice that. Okay, and how true does that feel? Out of 7?
10.
Okay, just notice that. And in relation to the actual thing that we're working on, the original memory, how are you feeling about that now?
Good.
Yeah? Do you feel that that got processed in today's session?
Yeah. Yeah, gotcha.
I believe EMDR fits into a Christian worldview because EMDR teaches us to transform our mind, Just like God told us, do not be conformed to this world, but be transformed by the renewal of your mind, that by testing you may discern what is the will of God, what is good and acceptable and perfect. Much research has been conducted on the importance of spirituality and mental health. Many ethnic and religious groups prefer seeking help from a spiritual leader instead of a mental health professional. This highlights the importance of integrating religion and spirituality into psychotherapy. The association between religion and the psychological disciplines seen today is not modern. This association dates back to the writings of Christian theologian Augustine of Hippo. Noted psychotherapist and author Alexandra Parvan believes recipients and perpetrators of violence should desire to distance themselves from the self's experience and behavior. Parvan also believes the distinction between the self and others can only be established outside strict psychological perspectives. This is all predicated on the writings of Augustine of Hippo. Augustine believed all humans are good and will remain good despite acting contrary to that notion. However, contrary to modern psychotherapy, Augustine did not believe it was intellectual insight, embodied experience, or a close therapeutic relationship that allowed him to gain freedom from his disturbing behavior. Instead, Augustine believed it was an act of God that provided him with the vision, knowledge, and love of God and God's creations. According to Augustine of Hippo, apart from God's agency, there can be no understanding of psychotherapeutic change. Augustine would say, "It is God who created a universe of good things. It is God who holds every substance in being. It is God who acts to heal brokenness, and it is God whose divine will draw the divided human's will to God's self." EMDR, much like other psychotherapies, allows the healing process of therapy to come from within the client. The therapist is a guide, a facilitator, and a witness on the client's journey to self-healing. The therapist does not cause change. The therapist guides the client to find the change within themselves. This is in line with the Christian worldview. Just as EMDR changes how we view our trauma memories, God calls his children to change how we think.
So EMDR fits naturally in a Christian therapeutic worldview. It is a therapy grounded in agency and choice, and it allows for freedom, and it targets negative, harmful cognitions. And then once those are targeted, it strips away the negative charge, and it replaces it with positive cognitions and the truth. And this is exactly what our Christian walk is and what Christ does for us. God's truth about who we are in Him. For we are God's handiwork created in Christ Jesus to do good works, which God prepared in advance for us to do. Ephesians 2:10.
Much like EMDR replaces negative beliefs about a traumatic event with positive beliefs, one can also see how accepting Christ and becoming a child of God can allow us to replace negative beliefs we have about ourselves, others, and the world with positive beliefs we gain through seeing life through the eyes as a child of God. Just as the Bible says, "Open my eyes, that I may behold wondrous things out of your law." So what do Christian counseling experts and scholars have to say? Well, I believe that EMDR and all psychotherapies have a place within the Christian worldview, and I believe the scripture is adaptable to any situation we can find ourselves in. Just like the Bible says, all scripture is breathed out by God and profitable for teaching, for reproof, for correction, and for training in righteousness, that the man of God may be competent, equipped for every good work. Lowenthal found that traumatized adults were more likely to report an improvement in religious faith after undergoing EMDR treatment. This led Lowenthal to ask if the change resulted from post-traumatic growth or alternative processes specific to religion and spirituality. Post-traumatic growth has been widely studied and is a determining factor when studying religiosity, post-therapeutic intervention with EMDR and other psychotherapies. Lowenthal's examination of articles comparing religiosity and spirituality outcomes post-EMDR treatment show positive RS changes resulting from EMDR. But these results are solely observational and require further examination using structured assessment. I believe this would make an excellent research topic in the future. Lowenthal believes that EMDR could offer an expeditious route to overcoming trust issues. These issues may prevent some people from engaging in religion. Some people may be seeking religion and have turned away from faith because of fear and terror from their past that is manifested as PTSD. But the Bible also teaches us that we should not be afraid because God did not make us to fear. For God gave us a spirit not of fear, but of power and love and self-control. Through EMDR, a client may free traumatic memories from conditioned emotional responses. This allows the client to engage in positive coping beliefs and induces emotional states of trust, faith, and calmness. When a cultural religious group places great value on coping beliefs, EMDR can facilitate a helpful and efficient method of achieving positive results. Layman and Layman have designed an approach to EMDR that incorporates biblical principles. With over 15,000 hours of practicing the manual approach, Dr. Layman has identified that establishing a connection with Jesus at the beginning of each session optimizes the benefits of Christian EMDR, or the manual approach. The manual approach does have significant differences from traditional EMDR. The manual approach does not use bilateral stimulation, nor does it use body scan or other several minor techniques in traditional EMDR. The manual approach establishes a connection with Jesus at the beginning of the session and looks to Jesus Christ during difficult times of the session. According to Layman, the manual approach is also safer than EMDR because it has the absence of bilateral stimulation and places God at the center of therapy. According to Layman, the manual approach is also easier than EMDR because it once again eliminates bilateral stimulation and places God at the center of therapy. The manual approach also accesses more truth, according to Layman, by relying on the principles of honesty through Christianity. It is also more effective than EMDR, according to Dr. Layman, because she claims that she has seen greater results with the manual approach versus EMDR.
So in the shower, I'm thinking about all this stuff, and fell into place pretty quickly. And then, of course, I started, feeling some pain and crying. And shower is a good place for that because nobody has to see you. So I said, Jesus, would you just help me out here somehow? And I almost felt like Rita, because, bang, a memory popped up for me where, and it wasn't a real painful memory, but there was a time when I was 9 or 10, and my family had gone over to one of my dad's friends' families, and I think they had a son about my age, and so the two sons and the two dads were out in the backyard, and we were going to play catch with the football. My dad didn't do a lot of that with me. Rarely did he do that kind of thing with me. So I was pretty excited and pleased about being able to do this. And I remember he took the ball and I think he punted it. I don't know why he did that, but he punted it. And it was, just a beautiful punt that sailed way over my head. And so I ran and I got it and ran it back and, threw it back to him. And I'm like, well, do it again, Dad. And for whatever reason, he just said, well, I don't think it's going to get any better than that. So I'm done. And he walked in the house. And I just stood there, very disappointed and sad. So I'm in the shower and I say, Jesus, would you help me out with this? Be where you need to be. And so immediately that picture comes to mind. And my dad goes, in the house, so Jesus is standing there with the football in his hand, waiting to throw it to me. And it felt really good. So that's where it stopped. The shower was over, and I had to go fix people all day. But that was pretty cool. That was pretty cool.
The thought that comes to me would be, would you be willing to go back to where you left off at the end of your shower and say, Lord, what do you have for me here? Just sort of engage with the Lord there around losing your father, the the ways that he was not able to give you what you needed even when he was still alive. Just all of that loss and grief around Dad stuff.
One of my dad's shining moments, in my opinion, was the way that he took care of my mom when she was being treated for cancer. He really stepped up to the plate and supported her and was with her. And so I kind of had this thought that maybe Jesus is kind of saying, these were gifts to you to show you what this looks like.
The thought that just comes to me is just to really say that real directly to Jesus. That meant a lot to me, that Dad shared that with me, that he had cared for a wife with cancer and knew what it was like to live with that. And that's something I really miss.
Lord, he did a good job with that. Maybe the Lord thought comes, I helped him with that. I was with your grandfather, and I was with your father, and I'm with you.
I'm so glad you said that, because symptom decrease is nice. But what's so much more wonderful is that you're actually growing in your kind of living relational interaction with Jesus in the present. Is that accurate?
Right.
So part of the fruit of that session and practicing it there and doing it there and being deliberate about it is you're doing that some on your own time. You're worshiping, you say, Lord, show me some times when you were present. Things are coming forward. So that part of the fruit of that session is it's actually growing and blessing your kind of living relationship with Jesus in the present. Is that accurate?
Exactly.
Throughout this presentation, we have seen that EMDR is a psychotherapeutic imaginal exposure therapy proven effective in treating PTSD, phobias, and other ailments. EMDR was first used with combat veterans and is now accepted worldwide. EMDR uses bilateral stimulation to reprocess memories. EMDR is not for everyone. EMDR is also adaptable to a Christian worldview, and EMDR has helped to develop a spin-off therapy such as a manual approach. Thank you for taking the time to watch this presentation on EMDR. I hope you learned something about EMDR and my method of adapting it to a Christian worldview. Take care, and good luck on your future endeavors.